Congratulations to all the moms to be. There's at least 4 people I know who are pregnant right now, and I'm really excited for them. If you are here, that means you are pregnant or either trying to be one, or if you're not, definitely you're gonna become one, because that's the beauty of being a female. And if you're a new dad to be, better take care of your wife properly, because this is a time where she needs you physically as well as mentally the most. Hi, I'm Dr. Nikita Guru, and I have a bachelor's in medicine and science, and I also have a background of working with obs and gynae doctors. Obstetrics is basically this branch of medicine and surgery which deals with females who are giving birth and take care of them during the childbirth, while gynecology deals with the disease or disorders related to the female reproductive system. Let's break down few of the words which you're gonna hear a lot during your pregnancy period or while you go to your doctor for the first time, and until it actually help you give you a kickstart and not be confused when doctors are talking with each other about you. The first one would be LMP, which is called the last menstrual period. They usually take the first date of your last menstrual cycle to take out your due date. Simple. Second would be a hormone known as HCG, which stands for human chorionic gonadotropin hormone, which is produced by your body while you are pregnant, and it is the hormone which is detected in your pregnancy test. And third would be a bunch of blood investigation that they do. CBC is like complete blood count, and in that the most they see is known as hemoglobin, which basically means the amount of blood in your body. During pregnancy, the amount of blood in your body is really important because you're gonna lose a lot of blood during your delivery time, and as well as you are feeding another person in your body, which means you need a lot of blood. Fourth, you will be given supplements of iron and folic acids. Iron need to increase the blood cell amount in your body, and folic acid is to not to take chance for the growing fetus in you to develop a defect known as neural tube defect. Neural tube defect in layman word means a defect that can occur in the spinal cord of your fetus. And fifth would be a blood glucose level, which is also done in female pregnant women, because there are chances that during pregnancy you develop gestational diabetes mellitus. That is the diabetes you get when you are pregnant. And when you are pregnant, if you get diabetes, then chances are that your fetal will develop hypoglycemia when it is born. Try to avoid it as much as possible and comply with what doctors are telling, because it's really important to prevent your child health. Sixth, just as diabetes, blood pressure is also a really important factor that is being checked while you are pregnant, because if blood pressure goes really high, then you'll develop pregnancy-induced hypertension, and which can also called as eclampsia, preeclampsia. It is just the worst phases of when hypertension gets worse during pregnancy. It's called eclampsia, preeclampsia. Eclampsia comes with seizures when you have fetal heart sound. It is very important during your pregnancy just to make sure that your fetus is growing well, it's healthy. It's a form of your baby communicating that it is healthy. They keep on measuring, especially when you are about to go into labor, just to see that the fetus is alive and healthy inside you. Eighth would be procedures or incisions that is given to you during your pregnancy, like PR, PS, episiotomy, CS section. PR would be per rectal. PV would be per vagina. It's when your obstetric puts his or her fingers inside your vagina and checks it if there is any tenderness, or see that the uterus or your cervix is healthy enough to birth and there will be no abortion. They do PV on every you visit your doctor, and especially during labor they check your vagina so that it is dilated enough and the baby can be pulled out. That means you can give birth to your baby, and which is a beautiful thing. Having said that, you can also prefer CS, which is cesarean section. It is an alternative form of not giving birth naturally, so it totally depends on you. There was this time one night, like whole 24 hours, I was on a duty with a doctor, and I helped him perform at least 10 to 12 cesarean section that day, and it was insane. Each case varied from one to another, and just in one day I could learn a lot. And another word is episiotomy. Episiotomy is a incision that is given to your vaginal area so that delivery of the baby gets easier and there is no any extra tissue tear. The good thing is that they stitch it up and it goes back to the prepartum phase, so don't worry a lot about it. Ninth would be epidural. There was this recent interview that I saw that this female was pregnant and she was wondering to take epidural or not. Epidural is a form of method of killing pain by administering the medicine in your epidural region around the spinal cord in your lower back. Symptoms vary from person to person, so the side effects also varies from one person to another. But as far as I know, there was this girl, she had given to two kids under epidural, and she told me that she kind of has back pain during winters, but it might not apply to. And after all the giving birth and everything, you're happy. You are not allowed to go right after you are given birth to the baby. You are kept under observation for at least 24 hours to see if there is any abnormal clot, you are having any sort of derangement in your electrolyte level, your hemoglobin level, everything they check of if there you have fever or because you caught any infection during your labor time. And on the same time, the baby is also taken care of and it's put under observation for at least 24 hours, and you'll be discharged with bunch of antibiotics, analgesics, that is painkillers for you, and keep following up your doctors as they have told you. You might have done a lot of research. Just to add on, I would also want to make you guys aware of postpartum depression. That is an actual thing. It's normal to feel low after you have given birth to a new child, because all the thing that your body has gone through is not normal. The pain is not normal at all. You feel low even after 2 weeks of getting pregnant. Then you should remind your obstetrics that you are not feeling quite good out there in your head, you are not that happy. Then they will refer you to psychiatrists who will guide you further, because nowadays there are more cases, maybe because they are reporting it, and that's also good that you are referring to your depression. If while giving birth normally, if they cannot deliver the baby with hand normally, they might use instruments such as forceps or vacuum. Vacuum is a cup that is fitted to the head of the fetus and you pull it out, and forceps is the same thing, but it's like a steel instrument that is put around, crisscross and put around the head of the fetus, and it is used in delivering the baby naturally. So don't worry, everything's gonna be normal. It is painful. I've not been through the pain, but I've seen a lot of female who have undergone labor, and during their phase of actually waiting to deliver the baby naturally without epidural, it's a fact all the delivery I've seen is without any epidural anesthesia. It's all pure natural, and it's kind of amazing that how they can go through it. You just be there, don't lose hope, have faith and pray to God, eat well, sleep well, exercise a little, maybe walk, and take care of yourself. That's it. Thank you so much for watching until the end. If you're new to my channel, please do subscribe, and thank you so much, guys. It's been an honor to help you guys through your pregnancy. Thank you.